Hello, my name is Grace Reese. I am a 7th semester nursing student, and today I will be demonstrating the nursing skill of tracheostomy care. The first part of this will be providing sectioning. Hi, Mrs. Jones. My name is Grace. I'm going to be your nurse today. Today we're going to be sectioning out some of those secretions from your tracheostomy, okay? I want to perform hand hygiene, provide client privacy. Can you verify your name and date of birth for me? Thank you very much. Next, I need to assess Mrs. Jones. I'm going to assess her respiratory status, most importantly. I'm going to be listening to her lungs. I'm going to be assessing the ease of breathing, any shortness of breath, any struggling to intake. I'm going to be looking at the secretions around the tracheostomy tube. And I'm also going to want to grab her blood pressure and her pulse. If any of these are elevated, it could indicate respiratory distress. Now that I have verified my patient, explained to her the procedure, and taken her vital signs, I'm going to establish a means of communication Mrs. Jones can have with me if she starts experiencing pain or distress. So Mrs. Jones, I want you to raise your hand if you're experiencing a lot of pain or distress during this procedure, okay? She says okay. Next, I need to make sure that my patient is at waist height and that she is sitting forward. I'm going to give her a towel while I do this sectioning, just so I don't get stuff all on her. I want to make sure that my patient is hyperoxygenated. So I'm going to make sure that she has the oxygen on before I start my sectioning, so that those oxygen saturations are okay. Next, I'm going to turn on the suction equipment. I want it at about 80 to 120. I'm also not going to want to suction for more than a few seconds at a time, like about 10 seconds. Only apply suction on the way out and give Mrs. Jones a 30-second rest in between passes with that oxygen so that we don't desaturate her. Now that Mrs. Jones is almost ready to go, I'm going to take this off before I put on my sterile gloves and make sure that I have my sectioning here ready to go. I'm going to have my sectioning care kit here first, which I will go ahead and open. And I'll go ahead and open my saline as well. And I can go ahead and put the saline in my little container here. Discard. Next, I don my sterile gloves after performing hand hygiene. I only want to touch the outer inch I only want to pinch the cuff of my sterile glove. These are older sterile gloves. They're normally a little easier to get on. Then, keeping my hands sterile, I slide my fingers under the cuff of the other glove. Being careful to mind my thumb. Once I have it on and I have both hands sterile, I can adjust my gloves. Okay, my next step is to take my suction catheter. My dominant hand, I'm going to keep clean through this procedure, and I'm going to wind this around. My non-dominant hand, I'm going to go ahead and get dirty by connecting this to the suction. And then I'm gonna do a few passes. Going in, and then applying suction on the way out, allowing Mrs. Jones about 30 seconds to breathe. Applying suction. And applying suction. Assuming at this point that her secretions are cleared, I will shut off the suction. I will wind the suction catheter in my glove while I am still, as long as I'm getting these gloves dirty, I'm going to go ahead and go in here and I'm going to remove this dressing, soiled dressing, and then I'm going to wrap everything in my gloves and throw it away. For the sake of conservation, I'm not changing my sterile gloves, but I would here otherwise.